Financial planning and security can sometimes be seen as a moving target. The rules change constantly, and you need guidance to stay ahead of the market moves. This is the Lebenthal Report with industry veterans Michael Hartzman and Dominick Tavella. We'll break down the news, trends, and overall direction of the markets, telling you what may be coming next, investment opportunities, and what to avoid. Now, here are your hosts, Dominick Tavella and Michael Hartzman.
All right, I'm Michael Hartzman. Today is Tuesday, September 10th, 2024. And I'm on, as always, with my partner, Dominick Tavella. How are you, Dom?
Doing great, Mike. No complaints. How about yourself?
I'm good, thank you. Thanks for asking. So, Dom, it's been a busy week. So we were off last week. So let's just jump into these numbers because it's really been, I think, a story of short-term and long-term results. Last week, as you like to say, was not a pretty week. It was pretty ugly. The S&P was down 4.2, the Dow was down 2.9, and the NASDAQ, leading in reverse, was down 5.76. And for the quarter, the S&P is only down less than 1%, 0.70. The Dow is actually up 3.55, and the NASDAQ is down 5.75. But here's the part that really shows me that the market, Dom, in spite of the struggles the last couple of weeks in this quarter, the market's been pretty stubborn, pretty resilient. Because year to date, Dom, the S&P is still up as of Friday, September 9th. I'm sorry, Friday, September 7th. The S&P is up 14.5. The Dow is up 8.5. And the NASDAQ is up almost 12, 11.75. So in the normal circumstances, on September 10th, wouldn't you say, I'll take those numbers now, let's shut it down, and we're good for the year?
I think I would have preferred saying that about a week, 10 days ago, Mike. I don't want to be greedy here, but we were substantially higher, just like you said, about a week, 10 days ago. The S&P's given back a little bit over 4, and as you said, the NASDAQ almost 6%. Both were plus 20% at the end of the quarter, and we've given a lot of that back. But resilient, I think, is a good word here, Mike. We've given a lot of it back, but it was seasonality. We expected to. We spent an awful lot of time talking about this, Mike, and anybody that was surprised simply wasn't listening or looking. But we expected a reasonably good pullback in these markets. The excuse was the employment numbers that we got last week, and that put a little bit of a scare in the market. And I'm sure we're going to talk a little bit more about it. But we think this is quite normal, even if we got most of the pullback in 1 week, Mike.
And I'm glad you used the word excuse, because that's the word we used this morning with our advisors on our morning call. And I think that has some validity to it, right? I think the market, especially around this time of year, towards middle to end of summer, where the market looks to take a breather, because, again, you look back a month ago, we got that really high CPI number where it was hotter than expected. And again, the market used that as an excuse to sell off a little bit. So
a little bit, Mike, was a full almost 10% pullback on the S&P and over 10% pullback on the NASDAQ. So these are pullbacks are sometimes can be pretty jarring to somebody who just opens up their statement or logs in and looks at their account. But it rebounded once the excuse was over.
Exactly, and that's my point. That's why I also said earlier the market's been resilient. Look, it's been ugly. I'm not, we can't sugarcoat it. The NASDAQ is down almost 6% this quarter. But that, as you pointed out, halfway through the year, the NASDAQ was up 20. And I don't think any reasonable portfolio analyst, Dominick, is really expecting the NASDAQ to be up 40% this year with all of the cross currents that we're facing.
Yeah. So to your point, Mike, let's take a second and just go to why, even if it is an excuse. We got some pretty not great, I guess I'm trying to be polite here, employment and unemployment numbers. The numbers came in a little bit worse than what the market was hoping for. And then the prior 2 months unemployment numbers were revised. So job growth has been substantial. I don't think using a bad word here, Mike, when I say substantially worse than the market was expecting, especially the hindsight numbers where they get cleaned up a little bit. And then I think dating back to April, there were some 800,000 jobs that somehow magically disappeared as those numbers were revised. So the markets, the economy is starting to look at a scenario where, a recession was completely off the table, Mike, and we've spent a lot of time on that subject, but all of a sudden, maybe not completely off the table, and that put a decent fright into the markets.
Recession fears it's still bubbling around. I personally don't think we're going to have one anytime soon, but you're right. It went from, nah, that's not going to happen to
Not happening, right? I mean, we
right.
went from analysts in the January 1st of this year, basically predicting the probability of a recession was pretty high. And therefore, the Fed would have to cut interest rates 6, 7 times. Again, we remind everybody that we thought that scenario was highly unlikely. And then they went no recession, and maybe even just a month or two ago, Mike, maybe no cuts at all through December. And now both cuts and possibility of recession are back on the table.
Yeah, so let's talk about that for a minute. What did happen in the last 2 weeks from our last show is we went from the Fed probably cutting rates next week to they're definitely cutting rates next week. And so I think the Fed funds has 100% probability at this point, Dom. Tell me if I'm wrong. But now it's a function of, is it 25, is it a quarter point, or is it a half a point? That's the
Again, at the
discussion.
end of the day, they make the decision, Mike, but I think you're absolutely correct. They will cut interest rates. And again, I'm repeating what you just said, Mike, so my apologies, but will it be a quarter? Will it be quarter of 1%? Will it be half of 1%? Honestly, does it really make a difference, Mike? In its economic effect, it's negligible. Car loan rates will be a little bit lower. Mortgage rates will be a little bit lower. The markets have already started to price that in. As always, I think Chairman Powell's commentary is much more powerful in terms of where it drives the market and why are they cutting rates? Good reasons, or inflation's coming down, the economy is solid, or bad reason, oh my God, we got to rescue this economy from a recession. So I think the commentary will ultimately drive the market higher or lower.
And I agree with you. I think economically it's going to take a long time no matter what they do to take an effect. But to your point, how they put a spin on 25 versus 50, I think will be critical, especially if they go 50. I think if they go 50, they have a lot of explaining to do because, again, we're 6 weeks out from a presidential election and both parties will jump on and latch on to whatever spin they want to make on what that interest rate turns out to be.
You're spot on, Mike, and not that anybody's going to listen to what I have to say or think, but I think they should cut 50. I think this economy, although not likely to go into a recession, there's a segment of our population that's really hurting and could use a little bit of a relief, whether it's credit card interest rates or if they need to buy a car loan rates or lease rates. So I think it would be beneficial and kind of put in there to confirm or help confirm the economy is not going to go into a recession. But we are dealing with the political environment, Mike, and we don't like to talk about this. But I think ultimately the Fed is going to look over their shoulder and go, hey, we don't want to influence the presidential elections, and might be the reason why they only do a quarter of 1%.
I was going to put you on the spot next week because we do have a show next week, the day before the Fed makes their announcement. But what the heck, I'll go on the record now. I may agree with you that maybe they should do 50, but I do think they're going to do 25 only because of what you just said. I think they want to make it apolitical, and there's not an October meeting, so conveniently they're meeting right after election day, and I think they could be a little bit more aggressive in November. I think they're going to be a little bit more softer next week.
I think we're both on the same page on this one, Mike. The commentary we're hearing, the whispers that we're hearing is that, and you already pointed this out, if they do go 50 basis points, they're going to have a lot of explaining to do. This chairman particularly has been very, very transparent in the actions they want to take. They've been signaling all along they're going to do 0.25%. So a 50 basis points, 0.5% would certainly, I think, surprise the markets. And can he talk us through it so it doesn't become detriment? Possibly. He's done a pretty good job so far talking us through it. Having said that, I'm with you, Mike, 0.25%.
And then one last point before we have to close out this segment, we'd be remiss if we didn't mention that the actual debate is tonight, and it might be the one and only. It's the only one scheduled at the moment. And, just tell me if you disagree. The outcome of the presidential election and the run-up to the presidential election normally in the long run has very little effect on the market. It's going to be a lot of headline noise. It's going to be a lot of chatter, but you and I continue to do what we do and not react to every polling number that we see on a daily basis.
Yeah, I'm glad you actually brought that up, Mike, and I know we're running out of time, but you and I spoke to a portfolio manager earlier, and I was just kind of pleasantly surprised, what actions are you taking because of the election? And he said, none.
None.
We're not going to manage our portfolio based on what we think might happen as a result of the presidential election. And as an add-on to that comment, who controls Congress, both sides, the Senate and the House, ultimately will allow whoever is president to take certain actions on whatever their wish list is. So we have a lot of stuff to go through, and ultimately we will have a new president, and ultimately we'll see with the composition of Congress, and then we will make some decisions on course of action, allocation, asset classes. But for today, I'm much more worried about what the Fed does and what the economy does, and we'll pick up that rest of that stuff later on in the year.
So tonight's guest, Dominick, is an author of a new book called In Pursuit of Unicorns. It's a journey through 50 years of biotechnology, written by Dr. Tim Harris. Now, you and I have not been financial advisors for 50 years. We both
Mike, I dare apologize for interrupting you. 40?
It's been a long time.
Been a long time.
And for most of it, we've always heard about the opportunities in biotechnology. Now, to be clear, Dr. Tim Harris is not a portfolio manager. He's not an analyst. He's not an analyst, but he's been on the forefront of this sector in this category, basically from its inception. So we're really looking forward to his thoughts, not only of where biotechnology came from, Dom, but where biotechnology is headed. In addition to the point you made, how does that interface with the new technologies we're dealing with now, such as AI, which I'm sure biotechnology is probably using some of.
The ethical perils of both, right, Mike? So this is fascinating guest tonight. I'm excited to get started. Hopefully this will be eye-opening for not only ourselves, but our viewers and our listeners.
So we'll be right back with Dr. Tim Harris, the author of In Pursuit of Unicorns, A Journey Through 50 Years of Biotechnology. All right, I'm Michael Hartzman, back with my partner, Dominick Tavella, and our guest this evening, Dr. Tim Harris, the author of the upcoming, soon-to-be-released book, In Pursuit of Unicorns, A Journey Through 50 Years of Biotechnology. Welcome aboard, Tim.
Thank you for inviting me. Pleasure to be here.
Thank you, Tim.
So, Tim, let me just basically start from the beginning, because your career in this sector basically dovetailed perfectly. And in reading the introduction to your book, the first line, modern biotechnology, genetic engineering, and cell manipulation originated with the 1973 demonstration that genes from different organisms could be recombined and propagated. So people read genetic engineering and cell manipulation. I think that still gives a certain part of the population nausea today and butterflies today. What was it like 50 years ago when you got involved in the infancy of this new science?
Well, it was exciting, firstly. I think that's the most important point. But it wasn't as though the scientists were doing this in a vacuum. They didn't not understand some of the risks that were potential there. And as you might remember, back in 1975, there was a conference called Asalama, where a number of the perpetrators of genetic engineering got together to work out what the risks might be, and in fact to self-regulate themselves so that they didn't do experiments that were potentially too risky. Those guidelines got turned into guidelines that were used in the US and the UK and other countries, and for quite a while were abided by until it was pretty clear that the technology, the recombinant DNA technology, was not risky.
So Tim, that right there is a fascinating comment. So a bunch of scientists just basically decided on their own, hey, we need to regulate this. We need to look at the ethical possibilities and come up with our own guidelines. No government interference. That's possible.
Well, the government was aware of what was going on, but Paul Berg, who was a Nobel Prize winner and one of the discoverers of the technology, was very vocal about making sure that the people who were doing the work were aware of the potential risks associated with it. And he made it his business, along with people like Sidney Brenner, another Nobel Prize winner, to make sure that the experiments were regulated properly. And they were careful to make sure that the regulations could be changed as more information became available, because you don't want to be in a situation where things are legally binding. So you can't move the technology forward as the technology demands, having an understanding of the risk, because changing the laws takes a long time. Having regulations which you can change as one of the people doing the work is a much better way to go forward. And that's the way the industry started, from a regulation perspective. But more importantly, there was the prospect of making insulin, growth hormone, tissue plasminogen activator, and other important proteins that could be used as therapies, including very large proteins like factor VIII.
Tim, speaking of that, what was the first win? What was the first success that these scientists said, okay, we're really onto something?
I think insulin was. I mean, I start the story with insulin. It's been talked about by others, but that was a race to clone the insulin gene by different approaches. And the fact that you could make insulin in E. coli, having cloned the gene in different ways, was phenomenal, and obviously meant that you didn't need to get insulin from bovine or porcine pituitaries anymore, because you could get it from pancreatic cells. You can get it from E. coli instead. You don't have to collect pancreases and extract the insulin from them.
So Tim, my kind of changing just a little bit of the questioning here. My experience with biotech was in the early 80s, and it became what looked at the time to be a viable, investable industry. And it was just an explosion of companies and valuations, and that came crashing down and became a really horrific sector to invest. So what were the early wins? And then what were some of the promises that just didn't, at least in the early days, pan out?
I think there were some unfortunate comments that were made during the Human Genome Project, which didn't help the industry. As you know, billions of dollars were wiped off the biotechnology sector by some comments made by both the Prime Minister in the UK and by the President in the US, based on information that was not entirely accurate. And I think that did not help. That was in the 2000-ish. Before that, though, there had been a lot of progress in making different products by recombinant DNA technology, as well as the burgeoning monoclonal antibody technology, where you could make monoclonal antibodies. And as you know, something like 16 of the top 20 drugs on the market these days are monoclonal antibodies derived more or less using the same technology that was worked out back then.
So is that what we talked about earlier before the show? Is that the messenger RNA that you mentioned, or is that something different?
No, that's something different. Monoclonal antibodies are a way of getting cells to make a single antibody. So drugs like Keytruda come from that technology. And as you know, Keytruda is, or still is, one of the most successful drugs out there for treating cancer, and has made Merck a lot of money and treated a lot of patients. goes hand in hand, of course.
So Tim, I'm kind of fascinated that when we look at what happened to the biotech industry in the early days, the internet industry in the 2000s, and today AI, there seems to be a lot of the same kind of parallels in that the promise, the early explosion in valuations and what this thing is going to do, and then the end product, usually further down the road. For you, this has been a 50-year journey.
Yeah, I've seen the reality checks a lot. I mean, and it's based on, to some degree, and maybe it's somewhat deliberate, a slight misunderstanding of what the technology can actually deliver. It's not like it can't deliver it. It's the time frame over which it's going to deliver it. And the time frames get shortened because people's expectations are not in line with reality. They would like it to be shorter, therefore it becomes shorter. And it is not, it can't be, it takes 9 months to have a baby. And in some ways, some of the technology, it takes 9 months for the technology to get to be mature. And you can't make that any quicker, even though the investors would like it to be quicker. It just isn't so. So AI is a great example. There's absolutely nothing wrong with AI in principle because it's very large data analytics from which you can draw particular conclusions. But the idea that artificial intelligence will design your drug for you and make your drug for you is actually not going to happen in the near future. It may not happen at all because you need experiments, and experiments are biology in cells or in animals. And in order to get a successful product, you need to test it in animals, and they are nothing like as predictable as some of the artificial intelligence analytics that, or rather the data that the AI is looking at. The animal data is not, you're not able to do the same sorts of things with artificial intelligence with animal models because of the variability than you can by looking at huge compound libraries or something where you can distinguish one binder from another binder. So it depends on the particular artificial intelligence question that you have in your mind. And people have to be realistic about how AI can actually help the industry. And it will help the industry. It's an important tool, but people need to put it in the correct perspective. And it isn't going to design your drug for you. You are going to have to do some experimental work to see whether what it predicts is actually what happens when you test it in cells or in animals. And the chances are it won't be quite as good as you would like it to be. So you have to go round the houses again.
So Tim, just getting back to what you said about the gestation period of these technologies, let's go back to 2020 and 2021, where some people felt rushing these vaccines from Pfizer and Moderna to market. And one of the reasons there was so much trepidation around these vaccines and people unwilling to take them was because of the speed that they were brought to the market. You being in the industry and you being, an active observer, how remarkable was it that a vaccine came to be so quickly and from all intent and purposes as effective as it was? Or, is it as a remarkable achievement as we think it is?
No, it's a remarkable achievement. Don't get me wrong, the speed with which those vaccines were created and put into people was unbelievable. I was completely surprised by how fast it went. Having said that, though, some of the technologies that were used, like the lipid nanoparticles that the messenger RNA was wrapped in, and the messenger RNA modifications themselves in order to make the messenger RNA more stable so it could make the spike protein when you vaccinated somebody with it. Those technologies had been honed over time for different applications, and it all came together when the pandemic hit, and people were smart enough to put two and two together and make four, and did it quickly enough to be able to get there in the 12 or 13 months that it took when the sequence of the spike protein first came out. I mean, just unbelievable. And I think I had my vaccine in March of 2021, which was just extraordinary.
Well, pretty much a year after the breakout.
Exactly.
Tim, I'm not
Lifesaver,
sure we'll ever know how
lifesaver.
many,
A
people.
lifesaver for many people.
Sorry, Tim.
Sorry, I said a
I think to your point, I don't know how many millions of people we'll never know how many passed, but how many lives do you think got saved by those vaccines?
Oh, millions, without any question.
Millions.
Millions, no question about it. It saved an overweight older person's life without any question. So you've got to give the credit where credit's due. BioNTech and Moderna did a super job. Pfizer did a super job, and the government, who were working closely with Moderna, did a super job as well. And there were other vaccine companies in the UK and elsewhere also doing a super job, and they got their vaccines around into people at much the same time. So just an extraordinary event, really. Extraordinary event that was helped to create an extraordinary event. Pandemic being extraordinary and the vaccine being extraordinary as well. It's interesting what people can do when you absolutely have to.
It's a good point. Tim, on that note, let's take a quick break and let's talk about, the future of gene editing and genome technology when we come back.
Love to. Thank you.
You're welcome. We'll be right back with Dr. Tim Harris, the author of In Pursuit of Unicorns, A Journey Through 50 Years of Biotechnology. All right, I'm Michael Hartzman, back with my partner, as always, Dominick Tavella, and our guest this evening having a fascinating conversation with Dr. Tim Harris, the author of the upcoming book, September 17th, a week from today, In Pursuit of Unicorns, A Journey Through 50 Years of Biotechnology. Tim, how long were you working on the book?
Well, it was probably a 2-year project. I had it in my mind for some time, but I only started in earnest just before the pandemic, really. And I wrote it. It probably took about 15 months to write, and then it took a little while to edit. And then by the time you've gone through that whole process, it probably took 24 months from beginning to end. And it was a huge amount of fun. And I relearned a lot, or remembered a lot that I'd forgotten.
Dominick and I frequently have authors on the show because of our relationship with your publicist, Lissa. And Dominick and I always joke around, it's unimaginable for either one of us to go through the process of writing a book. It just seems so daunting.
Well, it was to begin with, but it became less daunting as I started to think about the order of the chapters. And as I said, it's quite technology focused. So, and there's a time frame to the way the technology developed. So once I'd established what the technologies were that I was going to talk about, the order with which I talked about them became obvious. And then I wanted to interface with some of the things that I've personally been involved with, like strategic alliances with particular pharmaceutical companies, and what that strategic alliance was about and what we were trying to do for each other. And that all came together, which allowed me to tell some personal anecdotes as well as talk about the history of the industry. And for my mates who've read it, they've said that the bit they like is the anecdotes because they can hear me speak them, because I'm fairly straightforward in the way that I speak. And they love the fact that they can hear me saying the anecdotes that I say. So that was a great feedback for me, because that was the idea. It wasn't supposed to be a dry history. It was supposed to be as it said, a personal journey. But it's not about me. It's about the industry. It's about the technology. But it's seen from as I said before, from a journeyman scientist, if you like, and CEO who ran one or two companies, who was head of R&D in one or two companies, who happened by luck, really, to be involved in a number of the technologies that make up the industry today.
So, Tim, at the risk of putting you on the spot and coming back full circle to the title of your book, Unicorns, we talked about some of the early failures and promises that weren't fulfilled, and most recently, some just enormous successes. What are the unicorns that the industry is looking at? What are they looking at over the next 5, 10, 20 years that they'd love to solve the problems?
Well, we've mentioned one already. I mean, AI is becoming a unicorn business in a way. It wouldn't surprise me. And in fact, it's already happened where some of the bigger VCs are putting a lot of money on the table to get companies that are focused on artificial intelligence methods for drug discovery, that is definitely an area where there are going to be unicorns created. But as you know, unicorns are they're mythical creatures, and they disappear sometimes as fast as they appear. So it's all very well plonking the money down on the table, but you have to be sure that the products that these companies end up making are going to return the investment, because it doesn't take long for the shine to go off the unicorn, if you like, and then the unicorn escapes and you never see it again. And in the book, I actually talk about some of the unicorns that were companies that had market caps of 4 billion, and within a year they disappeared. And they disappeared because the fundamental technology, even though it was really exciting to begin with, probably didn't warrant the kind of investment that was made, and it didn't end up working. So you have to be a little bit careful. Doesn't mean that that approach of some venture firms of putting very large amounts of money to work is wrong. It just means that you have to be a bit careful, and you have to have a market that can support those kinds of companies. The more traditional way of creating a unicorn, as you know, it's kind of seed round, Series A, Series B, go public, get a corporate deal with a pharmaceutical company, and do your IPO and off you go. That is companies like Arvinas, for example, is in some ways a more reassuring way of creating a unicorn. So I say in the book, which unicorn would you rather ride? Would you rather ride a Arvinas kind of unicorn, or a unicorn that's created on the back of some really sexy technology, but doesn't in the end turn into successful products? Because that's what is important. You can have as much technology as you like, but at the end of the day, what the company is valued on is the products that it creates. And that's important for the patients as well as for the investors.
So to that point, and I hope this question makes sense, what comes first? Is it the technology in search of solving a problem, or is it a problem looking for the correct technology?
I think the whole industry has been technology driven. In other words, the technology of doing, for example, and we talked about it before the show, gene editing, for example. Gene editing wasn't developed in order to make products. Gene editing was developed because it was an important way to be able to understand some biology and some biochemistry by being able to change independent genes at will. The fact that you could do that meant to some people that, well, maybe we can use it to do something useful from a therapeutic perspective, as well as understanding more about the biology of a particular disease or a particular phenomenon. So I think it's very much driven by technology. And I use a quote from Sidney Brenner that says that technology is probably the most important driver of the industry right from the very beginning. And that's one of the reasons why I focused on it for if you like, for the meat of the book. It's technology that drives the industry and will continue to drive the industry. From CRISPR to CAR T cells for treating lymphoma, those are all technologies that were designed for understanding things rather than to make useful products. But it turns out you can understand things and make useful products.
Tim, I'm fascinated by the earlier comments, how the industry itself took it upon themselves to come up with ethical solutions on how this technology was going to be used in the future. And we're seeing that same kind of discussion today with AI, and there's a real fear by a lot of people out there, and understandably so, that AI can be used for bad, not just for good. How do we deal with it, and how do we resolve those kinds of issues?
Well, I think that's a really complicated question, and probably, as they say, above my pay grade. But I'll give it a shot. I mean, I think the important thing is to get informed opinions. That's really the most important thing. And you can look at the regulation of biotech, and biotech was those regulations were drawn up by very well-informed individuals who knew about the technology that they were working with. I think the same solution can be applied here. And although the prospect of big tech companies and some of the dangerous things that they might do I think when you really look at it and you talk to the people who are involved in the technology, they're not driven by those kinds of they're not driven to do what they do for those reasons. They're driven to do what they do because they want to make the technology useful, either for therapeutic benefit or for other benefits. And those are the people that need to be able to inform the debate about what is or what isn't likely to be a risky thing to be doing with the technology. The worst thing that can happen is that it's people who don't know much about it that get involved in making the regulations.
You don't mean politicians, do you, Tim?
I'm trying not to use that word, but I think it depends on who they're advised by. And I totally understand what politicians have to do, but the best politicians are the best advised politicians. In other words, they understand what they've been told by the experts who really understand what it is. And as you know, humans are not particularly, especially in your business, humans are not particularly good at understanding risk. They have to be helped to understand risk.
So Tim, your conversation just now really goes perfectly with my next question. The whole idea of gene editing has been met with controversy, especially in the religious community. As we see this technology saving lives, and to dovetail what you and Dom just said, do you feel that the religious community has softened and embraced gene editing and the way it saves lives, or is there still some reluctance among certain theologians as well?
Well, I don't really know because I don't know the theologians well enough, but I hope they watch and listen to the informed debate about what's been happening. And we mentioned sickle cell disease and the fact that you can use gene editing to affect the sickle cell mutation in individuals who've been born with the disease. I think it's outstanding and amazing that CRISPR technology has been used successfully to launch a product called Casgevy, as you know, a Vertex, a CRISPR-TX combination product. It's just fantastic. And I think that, if you like, I'm not a particularly religious person, but I think you have to look at it from the perspective of, is this doing any good? And to whom is it doing good? And I think the answer to that question is fundamentally yes. You are helping children with sickle cell disease to overcome their disease, which, as you know, is pretty difficult for not only the individual with the disease, but the family in which they live. Their whole lives rotate around having the disease. And I think I mean, as you know, with your own lives, if you have a particular event around which everything circulates, it reduces your ability to enjoy life a good deal. And so anything we can do to help these patients, we should be doing. And the CRISPR technology has proven to be particularly useful.
So on that point, Tim, and obviously that's a huge success story, or hopefully one that'll even be greater. But what can we look at going forward? I remember the promises in the 80s, we're going to cure cancer, but what can we look at going forward and going, you know what, that's within at least the realm of possibility?
Well, okay, so let's look at that, curing cancer. Well, I think CAR T cells, which are used to treat non-Hodgkin's lymphoma, have revolutionized the treatment of that disease and the different forms of lymphoma where CAR T is used. This is where you modify T cells. You take T cells from a patient, you modify them, and you put them back in to the patient, and they kill tumor cells as a result of you modifying them and putting them back in. It's fundamental technology, and it works. And so, does it cure cancer? Yes, it does in some patients. The durability is not as long as we would like it to be, but it is durable enough in some patients to give remissions for 2 to 3 years. Now, if you can then look at that and say, can we develop CAR T cells that go against solid tumors, pancreatic cancer, colon cancer, breast cancer, prostate cancer, then if you can do that, then that's going to change the profile for these patients as well. And that's alongside all the new antibody technologies where you can make an antibody with two active ends rather than just one active end, called bispecifics, or you can attach a radiochemical to one end, or you can attach a drug to the other end, so that you've got these bifunctional reagents that home in on the tumor and kill them. And that technology is here and now and is saving lives and will continue to do so. So I'm really enthusiastic about where it's going, and I'm waiting with bated breath to see what the next technological breakthrough is, because, as we said, it's the technology that drives the applications. All of those things I just mentioned are based on fundamental technology advances, which have now been turned into products of various kinds. That's where the emphasis is.
So just to follow up on that, is right now the emphasis to keep cancer at bay, or, to Dom's point, to actually cure cancer and eliminate cancer?
Well, it would be nice to do that, but I think the real target is to turn cancer into a disease that you can live with, because it's in remission for much longer, and you don't have to be worried about it on a monthly or a 6-monthly basis. Curing it is tough. Cancer cells are particularly good at making changes to their genetic material so they can escape from all sorts of things that you treat them with, which is why a number of different modalities are used to treat different cancers at different times, because they get resistant to the first one, then you have to have a second one, which is a backup. And the more of those you have, the longer it is you can potentially outlive your cancer. But to get cures is pretty hard, and they are, if you like, long-term remissions, and there are some, and let's hope they continue. And the key, as you know, is early diagnosis. The earlier you can get to see that somebody's got something and you can get rid of it, the more likely you are to be cancer-free.
In just continuing the theme, obviously we saw this new technology in the COVID vaccines. Is that new technology also, I understand it's being developed and continues to be developed to cure other things, or at least battle other things?
Yes, in fact, cancer vaccines, if you like, have had a bit of a renaissance since the COVID pandemic, because the messenger RNA lipid nanoparticle technology that I mentioned can be used and is being used by Moderna and Merck and others to make personalized vaccines against patients with melanoma, where you understand what the changes are in the cells and you make a vaccine to allow the T cells in your body to attack those particular cancer cells. It's very clever and it works, and there's more to come. And it's as I said, a bit of a renaissance for cancer vaccines. So that's something to keep an eye on.
Tim, another sector, we talked about insulin earlier in their first segment. Can we talk a little bit about the GLP drugs? My understanding is, in addition to getting diabetes down and helping with weight loss, is that these really are wonder drugs, and they're discovering all the time the other benefits of these GLP drugs. So what was the renaissance of that? Where did these drugs and these formulas come from?
Well, again, they came from an interest from the biologists in understanding what regulates the metabolism, and when it goes wrong, you get obese. So these molecules were derived from those studies, and there are dual ones, there are triples, and there is just GLP-1 agonist single ones that are being used. You know, I have been asking myself the same question, which is, do they protect against cardiovascular disease to quite the same extent as we are told? And, you know, I don't like to opine unless I've read the data and seen it. And I don't know the data in this case. The people who do know the data seem to think that they are having a protective effect, and they're kind of wonder drugs. I guess as I get older, I become more cynical. I'm not really a great fan of wonder drugs, so I think we'll have to wait and see. I think some of the side effect profiles of those drugs, like loss of muscle mass and the nausea and gastrointestinal side effects are an issue. Novo and Lilly are perfectly well aware of that and are working hard to overcome it. But whether they become the kind of your drug on your belt that you take every day in order to cure all ills, I think we will have to wait and see. As I said, looking at it from a 50-year perspective, I somehow doubt it. But they do have their place, and they are phenomenally successful.
So we've talked about some of the successes and maybe hopefully some of the future successes, but like anything, there's a cost factor. In this case, literally a cost factor. Some of these wonder drugs that are being developed are being priced at pretty hefty, I want to say astronomical prices, but the development costs are exceedingly high. I'd love to hear your opinion on where that is going to go, because we're starting to see some kickback, and the politicians and the government that pays for a lot of these drugs, we're starting to see some significant kickback on that.
Yeah, I understand that, actually. And having come from a country where they have NICE, which is a regulatory body for making sure that drugs are cost effective, I think you have to look at it from that perspective. You really have to ask the hard efficacy questions before you start to say, is this drug overpriced or not overpriced? And then you've obviously got the issue of who's going to pay for it. And I completely appreciate the amount of money that is spent developing these drugs. And I understand the need to recuperate that investment. And I understand all about shareholder value and protecting shareholder value by making sure that the drugs are priced appropriately. But at the end of the day, the most important criterion is, are they cost effective? And do they really do what's advertised on the label? And will people who take them have a thorough benefit from taking them? Then the next level is, and okay, that's true. Now, who is going to pay for it? So I'm not against a careful attention to drug pricing, but again, like a lot of things, you have to do it in a very knowledgeable way. You can't make universal statements about these drugs as a class are too expensive, or these drugs are not expensive enough. You have to look at it from the perspective of the disease that they are treating, what the alternatives are, what the quality of life for the patients who are taking them would be without them, and factor those in for those pricing decisions. And I am by no means an expert in that area. I know people who are, and I guess I'm just a person who would like to think that I'm not overpaying for a drug that is helping me.
Well, to that point, we have about 4 minutes before we have to wrap it up. Do the science community consult with the insurance community? And I think the GLP drugs are a great example where you see now they're more accepted to use these remedies and be covered by insurance. What is that? Do you have any idea what that process is, and to get the insurance companies on board?
Well, actually, I haven't got, it's not a part of the business that I've been in, but I can tell you there are a number of insurance companies that will not reimburse particular drugs. Sometimes I think that's completely justifiable based on the drug. And sometimes I scratch my head and think, well, why aren't they reimbursing that drug? Because it's actually pretty important and pretty helpful to those particular patients. So again, it's an informed decision that needs to be made. And these people are not stupid. They make those kinds of informed decisions by the appropriate conversations, which I am, as I said, not party to. But believe me, it's not done in a kind of slapdash way. They think very hard about it before they make decisions not to reimburse or to reimburse.
But Tim, and I'm not here to defend the drug companies or their pricing, but we look at these, I want to call them weight loss drugs just for everybody to understand what we're talking about. But the long-term implications of weight loss, heart disease, and diabetes, I mean, those are kinds of diseases that are excruciatingly expensive for an insurance company to pay for over the lifetime of that patient. Short-term, you might have a higher expense, but long-term, you could have significant savings.
Absolutely. And that's the difficulty, because that's not, I mean, well, again, way beyond my pay grade. That's not a particularly easy equation to work out. It's to do with the cost of the diabetic foot ulcers or the blindness that occurs in the diabetic patients. How do you and that's over time. So how do you factor that into the decision about paying however many thousands it is for the GLP-1 agonist in order to prevent those secondary effects happening later on in life? But again, that's a whole different business, and you would need somebody other than me.
We lost him for a minute.
Hopefully he'll come back, Mike. And we are getting to the end of our discussion. Fascinating stuff and way above my pay grade, at least. But if nothing else, it gives us a forum to throw these ideas out and these thoughts out.
Yeah, and even as he was saying, even the ancillary, forgetting diabetes for a second, which is a dreadful disease, but if you're on these drugs, you could be on less blood pressure medicine, you could be on less cholesterol medicine. There's so many ancillary benefits.
Mike, think about coronary disease and the surgeries involved and the drugs you'd have to take and the disabilities that you'd have to pay for. I mean, the potential cost savings are just on another level. And I just hope that maybe we find a pleasant compromise where the costs come down a little bit over time, and the long-term benefits are actually priced into that drug.
So we lost Dr. Harris, and we have about 30 seconds to go. And I think he's going to log back on to just have enough time to tell people where to buy his book. But it's in Pursuit of Unicorns: A Journey Through 50 Years of Biotechnology. The book is going to be available on September 17th. And unfortunately, I think we're out of time, so I don't think we're going to get a chance to bring Tim
sorry,
back.
I lost you, but thank you very much for allowing me on your show, and thank you to your listeners for listening.
Thank you, Tim. A fascinating subject, and one that both myself and Mike actually have lived through. 40 years in the industry, Mike. I remember the biotech revolution very, very well back in the 80s and the investable side of it. So scarred for life, I'm going to call it. But
enjoy the book, because it will remind
thank you, Tim. Looking forward to reading it.
Take care, guys. Thanks a lot.
Have a good night, everybody.
Bye-bye. Thanks
Good night, all.